3, 2, 1, go. You're listening to The Kyle Chambers Show.
Hello, everybody. My name is Kyle Chambers. This is The Kyle Chambers Show. I'm here today with Mark Plawker. Mark is a urologist, and he has been a doctor for over 30 years, and he has his own medical practice in Staten Island, New York. Thank you for joining the show today, Mark.
My pleasure.
Maybe tell everybody more about your practice and what you do and how you got involved in urology.
It was really in medical school. Most medical students don't even know what urology is, but it's a surgical subspecialty. And I was actually working on a cardiology rotation, and I met a urologist in the hospital who asked me some questions about a chart I was holding on a patient while rounding on them for a cardiology problem. He asked me my name and my interest and was sort of making fun of cardiology and saying that's not an interesting field. You should really think about urology. And we got down to talking, and he invited me to change my surgical subspecialty rotation, which was supposed to be ENT, to urology, and told me I'd have the best time in the world. And I sort of did. And suddenly my interest changed, and I went into urology. And, didn't look back after that. I've been on all sides of urology. I trained at some of the toughest hospitals in the New York area. Patients, underserved neighborhoods that had a very unique experience. Since I trained, I've been in practice for over 25 years in Staten Island. I have one partner. We have a freestanding building, which is our office, and two surgical ORs where we do the procedures that I still do there. For a good part of my initial career, I was still very involved in academia, but I still was doing a lot of research, a lot of publishing, a lot of presenting, lecturing, that sort of thing. And up until about 2 years ago, I was still teaching, every year, mostly at Wagner College in the PA program, but I had spent years in the past lecturing at some of the medical schools, and I still, right now, I'm on the clinical faculty at NYU. Although like I said, my practice is in Staten Island. That's my layout right now.
How do you stay updated on the advancements in urology?
Urologists are gadget people, sort of like ENT people. I guess all the surgical specialists. We like to use newer, high technology tools for our craft. And this is, cameras that go down spaces that are just a few millimeters, lasers, all sorts of other equipment that help us do things that used to be big cases in hospitals, now is less invasive or minimally invasive, little procedures that we can handle in an office setting. I spent sort of most of my years doing a high volume of surgery at the hospital. And just with age, and because, in any professional life, you have to sort of know what you do and sort of limit it more as you move along in your career, know your strengths and weaknesses. So now I'm doing a lot of more smaller cases in my office, and technology is very important for that. It helps us diagnose a lot of things more accurately that we couldn't in the past, and it helps us fix things with a lot less trauma to the body, no hospital stays. And so, the urologists are great at that. Thank God we have a lot of really super smart people in urology with engineering backgrounds, and they've really brought urology to a very high level of technology.
How do you approach patient education and engagement in your practice?
That's an interesting question, and I'll tell you why. It's a little near and dear to my heart. After about 4 years in practice, going way back, I took a year off, and I was doing a lot of academic work. And I was in the midst of transitioning from my practice back then to the two-man group I have now. But in that year, and then for about a year and a half after, I did realize the importance of proper patient education. And I always felt as a surgeon, patients can't be educated enough because surgery is never going to be perfect. It's not, never has been, never will be. It's like anything else in life. Perfection is not real. It's something you strive toward. I came up with an idea to write patient education literature that was initially meant for just urology. And I did it on about 52, I think, different procedures we do in urology. And this was literature that was everything a patient or family member should know about how to prepare for this procedure, why it's being done, what the disease is, or why the test needs to be done, what's going to happen during the procedure, what to expect after, what the follow-ups will be. And these were written to be very understandable by patients at any type of educational level. And I made sure to do that. Well, I didn't realize when I was doing this in my own practice that this would get picked up by a big publishing company, and they then transferred it to CD-ROM, and then they engaged me to oversee the same patient education literature for other specialties, which I did for years, which was general surgery and gastroenterology and ophthalmology and so on, and OBGYN. And so that series became very popular for doctors to buy so they could distribute it to their patients and educate them better.
How do you balance your professional and personal life?
No one ever said that surgeons were home a lot if they were busy. I mean, that's not a profession that sort of allows you to be at home quite a bit. But I always made certain that whenever I could, I would alter my schedule, even if it meant, sleepless nights, and trading places with certain people for calls or whatever it might be. I made certain with my two kids that I was there for their games, their athletic events as kids. And of course, in karate, where they competed for 10 years, all over the country and sometimes out of the country, I never, ever, ever sent them without my support, my being there. To me, it was just as important. But when you do something that, requires an incredible amount of hours, and it's not just the hours that you're at work, but, if you're a busy clinician, your phone is never really off. You get calls through the night. And I spent a lot of years on weekends where I might wake up and have breakfast, and then I'm gone for 7 or 8 hours on a weekend day. And then I might have to go back at 1 a.m. for an emergency. And that went on. But as you get older, you do that less and less because there's younger people that want to do that. And so you can sort of give some of your call, responsibility away. I wouldn't ever say that being a surgeon is a great thing if you're the type of person that always wants to be at home and have a perfectly balanced, personal life. It's not possible.
How have you helped the karate circuit promoters from your medical point of view, giving them different points of view on how they can make the tournament safer as well?
I think the promoters, they obviously want to do their best to make sure nobody gets hurt. There's a false sense of security that they have medics at these tournaments. Medics are great to stabilize an injury, but they are not there, or they should never be there, for being diagnosticians of certain things. We've all seen lots of people get knocked out, and I've seen medics called to unconscious competitors, and they're making decisions about whether someone can compete further. And this went on for years and years that I saw, there's no test you can do at the ringside to say whether somebody has a dangerous type of concussion. You cannot flex someone's neck back and forth and say you don't really have a severe neck injury when everybody saw someone's head flip back really hard and somebody went down. Fighters are overzealous. And it could even be a forms person who falls. They want to be back. They don't want their weekend to end with an injury and a loss. But that injury and loss can extend so much further into their life and affect them down the road when things aren't properly attended to. And I've had this conversation with so many people, and I've said, look, believe it or not, this sounds crazy. You're almost better off not being involved and not having a medic there. What a medic should be strictly to do is a life support maneuver. Push on something that's bleeding, splint something that's clearly broken, provide an airway for somebody who's not breathing. These are things that have to be done in the field, and that's what they should be there for. They should not be diagnosing possible fractures, ligament tears, concussions. That is way beyond the scope of what they can do and what they should be asked to do. You're not putting them in a good place either. And promoters, look, these have been going on, these tournaments, for a long time, but they put themselves in a very dangerous position by allowing certain, competitors to continue that I've seen. And I've had to many times over the years tell somebody, you're down, you're out, you're finished, overriding, the medic's decision or your dad's decision or your mom's decision or your own personal decision. We saw what happened here. It's not easy to promote a tournament and have everything be perfect. I think you just have to learn from mistakes and things have to evolve, especially safety. Safety is always the biggest thing because it takes one catastrophic injury so that a promoter will never have that tournament again. There's always the age-old question about fighting adults. It's technically you're in the 18 plus division, but if you're 16 and a half and you're, some sort of fighting enigma, or you're 17, but you're in the 18 plus division because your birthday's on a certain day, that's karate age. That's not your actual age. So if a 21-year-old is hitting a 17-year-old, you could say, well, those are our rules in the sport. No. Your rules in the sport don't count. You have an adult hitting a minor. So I've always advocated that, the 18 plus division has to be actually 18. You have to be 18 to be in the 18 plus division. That is what defines an adult. We don't get to define that in a sport. There are laws that define that. So that's something for them to work out. And, again, I'm not a promoter. I've only can make suggestions I think protects the promoters because I'm looking out for the sport.
Yeah, it's pretty interesting. Thank you so much for joining the show today.
My pleasure.
This has been the Kyle Chambers Show.
Thank you. Take care now.